The numbers that are coming out of the White House, 2 million people, about 1 million for the federal administered and about 1 million for the much smaller state administered. Are those real numbers?
No, they're not, because they're numbers of people who have, quote, selected a marketplace plan. And as you know, you aren't actually truly enrolled in a health insurance plan unless you have paid the premium to the insurer and the insurer has received the premium. And your estimates, the estimates of CNBC reporters, Dan Mangan and Jody, I forgot her last name, excuse me, they've estimated that 75,000 people who've actually paid for the premium. And more important than that, actually, is the White House won't tell us whether or not these are healthy or sick people who are signing up for the plan. All the indications are that these are elderly people and sicker people who are signing up, but the White House won't give us any indication of that, which suggests that they're very concerned about that problem.
Right. The demographics may be very costly for the insurance companies and may be very costly for the federal government, who I'm told is going to back up the insurance companies. If the insurance companies back up the individuals who want to enroll, but we don't know if they're enrolled, who want to pay maybe, but we don't know if they're paid. So there's kind of a catch-22 in this, Avik.
Yeah, so the basic thing about Obamacare is it makes health insurance really expensive for healthy people in order to make it somewhat less expensive for sick people. So that's obviously a great deal if you're sick. It's a terrible deal if you're healthy. And so we're not surprised to see that a lot of sick people or people who are eligible for the subsidies are going to sign up for these plans. But a lot of healthier people who are going to pay double or triple for their premiums, they're not happy about it. And just to contradict what Dan said, well, these premiums are coming in lower than what people expected. That's absolutely not true. The president promised that every family in America would see their premiums go down by $2,500 per family per year. It's the opposite of that, and that's a big problem.
I mean, yeah, Dan, you got it. Dan, old buddy, we're happy to have you on the show. We want your perspective on the show. Believe me, we always have both sides of the aisle. But you're pulling numbers out of the sky. I got to go with Avik on this.
I'm sorry, I can back that one up. But you know, the other thing I want to point out here is that this is generally very high deductible insurance. The average silver plan has a deductible of $2,500. The average bronze plan has a deductible of $5,000. So this is really high deductible insurance, and it is going to require individuals to assume a lot of the burden of their care. And I think to Avik's point, you know, the fact is also that if you have chronic illness in this model and you come in, you have multiple sclerosis or rheumatoid arthritis, you're going to be paying a lot out of pocket, and it's a very significant level of cost that is going to be put back on the individual. Now, I don't think that's a bad thing. I think that's the only way that you can afford to put this kind of system in place. But this is a competitive market with the same insurance companies that are giving care to the employed population, offering insurance in this market.
Avik, let me get your quick response, and I just want to add one thing. At this stage of the game, for what we know, and I know it's a big estimate, the federal government's not helping us at all, are there more uninsured or insured? Here we are, New Year's. Which is higher?
Well, we have about 6 million cancellations, and if you go by the administration's definition of enrollment, it's 2 million, so that's still net negative. But let's get to this point about the high deductibles. Look, high deductible plans are great. Narrow network plans are great. That gives people the choice if that results in lower premiums. The irony of Obamacare is these tools like high deductibles and narrow networks, which are designed to actually lower your premiums, are being delivered in plans that actually double or triple your premium. So all that, the design of the benefit is not terrible in terms of the deductibles and the network. What's terrible is how high the premium is, and that has to do with a lot of the other things that Obamacare does to deform the insurance market.